Why do my staff keep disappointing me? In a previous video, I covered off the first of two reasons why practice owners often ask themselves this question, which is a lack of clear, regular communication with their team. Just because you've said it, it doesn't mean that they've heard it and understood it. Now, the second cause for disappointment in staff performance is normally the lack of good management systems. A management system is just a way of easily measuring the important numbers that your staff need to meet each week in order to help grow your practice profitably. They really can set the practice up for sustainable growth without you always having to be there. So there are three components to a good management system. One is recording the results. Two is a weekly meeting to discuss and view the results. And three is training to improve those results. Sounds simple? Well, it is, but it's not always that easy to implement in your practice. If it was, all practice owners would be doing it. One really important piece of advice is that simple beats complex every time. So don't try to make your management system overly complex, because whilst it might look impressive, if it's at all tricky for your team to understand and follow, it's not going to be effective at improving results, which is all you really want as a practice owner. So let's start with the targets, or the important numbers to enable your business to grow. Every practice is unique, so you need to have a think about the most important numbers for your team to focus on. Numbers and KPIs is the language of business. So these might be number of rebookings, number of cancellations with no rebook, conversion rate of new inquiry to treatment, number of new referrals, number of new clients, even the number of extra services accepted by patients. Whatever the numbers you decide are the most important to track with your team, my experience is that the fewer you track, the better. Because if you look at too many numbers, you just dilute your attention. So only pick what you think are the most important 1, 2, or maybe 3 KPIs. It's often said that in business, being able to simplify things is true genius. The second component of good management system is regular short weekly catch-up with the team to discuss these KPIs, or lead measures as they're sometimes called. I can tell you that weekly is the best meeting rhythm to get into, far better than fortnightly or monthly. And there are two very important requirements for these meetings. One is that they're very short, 15, 20 minutes max, and they follow a fixed agenda. If they blow out much beyond 20 minutes, they do become a talk fest and just won't be maintained, because we're all busy and really just want to get on with our work. Remember, this meeting is not a general catch-up to discuss what's going on. It has a clear purpose, agenda, and outcome, all centered around improving the KPIs. Two is that they're in everyone's calendar and they're set in concrete. So the meeting is absolutely never missed by anyone except for unexpected events. And if as a business owner you're afraid of locking yourself in, I can tell you that a structured weekly meeting will actually give you more freedom in your business. Please trust me on that. Now, the third component to a good management system is regular ongoing training. So one of the biggest mistakes practice owners make is assuming that what they do so well must also come naturally to everyone else in the team. It's a really damaging assumption. So after almost every weekly meeting, you should come away with some type of training or development for someone, even if it's just a 5-minute chat or recap immediately after the meeting with one of your practitioners. Over the years, I've seen that when practice owners do regular, short training sessions with their teams, or even just with an individual team member, the staff view the training as a positive. It's a very different mindset to that reactive training we do whenever stuff hits the fan, which just leaves our people thinking, I can't do my job, so I'm being trained. So just to recap on the question, why do my staff keep disappointing me? In most cases, it's a lack of clear and regular communication between the owner and their team. And secondly, the absence of a good management system. And you might be thinking this is all pretty simple stuff, and it is, but do expect a bit of trial and error. Try different KPIs, different meeting schedules. You won't get things perfect in the first couple of months. But if you keep at it and persevere, you'll be astounded by the improvement in your practice and your stress levels. Really hope this helps.